First of all, we want to know that what is the role of the ejection fraction in the overall heart failure management and even the diagnosis?
Well, first of all, ejection fraction simply means the percentage of blood which is ejected from the heart ventricle during a contraction. And the normal value is something like over 55%. And obviously, when the ejection fraction is decreased, that means there is less blood flow going out of the heart to supply the various organs of the body. And what actually, when it comes to heart failure, an ejection fraction of less than 50% confers a 10 to 12-fold risk of developing heart failure.
Okay.
So that's very, very important in terms of the heart failure. Actually, even there's a study which shows that even if the ejection fraction is between 50 and 55%, there is still a high risk of developing heart failure. Lower than, of course, less than 50%. Yes. It's an intermediate risk, but still developing heart failure. Also, ejection fraction is what is monitored anytime when the heart failure is managed by various medications. So we look at whether there's a change in the ejection fraction, whether the ejection fraction is getting better, or whether it's remaining the same. So that's why this is very, very important. So actually, ejection fraction is a very critical parameter when you assess patients with heart failure, in the assessment as well as the management of patients with heart failure. And heart failure is very important because 50% of patients with heart failure will die within a few years, 50%. So it's a very serious condition, and the ejection fraction plays a vital role in the management of these patients.
Right, sir. So, but especially in the patient who are post-PTCA or who have undergone the PCI, what is the role of the ejection fraction, especially in predicting the overall mortality?
Yeah, again, I think there also the ejection fraction plays a very important role. But if you look at patients who have had myocardial infarction, heart attack, and who have had actually undergone angioplasty, PTCA, again, if you look at the various factors which relate to mortality, and we can look at KILIP class 2, we can look at anemia, can look at chronic renal disease. Out of all these factors, the ejection fraction is the most important. So the lower the ejection fraction, the higher the mortality in these group of patients.
Right. So can you enumerate other usage of the ejection fraction as well?
Yeah, I think one of the most important uses of doing an echocardiogram is actually to look at ejection fraction, and then of course to look at other valvular and other pericardial and congenital abnormalities. But even in those conditions, ejection fraction plays a very vital role. In terms of, for example, to decide whether a patient needs an implantable defibrillator, again, ejection fraction becomes very important. The ejection fraction is lower than 30-35%. Those patients need to undergo a defibrillator. Right. And also, when it comes to biventricular failure, again, the ejection fraction is one of the very important plays a very important role. In addition to, of course, other parameters like left bundle branch block. And again, if you're deciding to send a patient for cardiac transplantation, one looks at ejection fraction because it's a measure of left ventricular function. If the left ventricle is not working very well, those patients will obviously undergo a cardiac transplantation. So
definitely it's a very important parameter. So, but what are the upcoming parameters which probably can supplement the ejection fraction or even can compete? Yeah, well, especially if you look at echocardiography or magnetic resonance imaging, we have deformation imaging, which looks at the base of the heart moving towards the apex. And so that parameter, we call it the global longitudinal strain, that is actually coming up, and that can actually supplement ejection fraction because it has been shown that in some category of patients, the global longitudinal strain may decrease even before the ejection fraction decreases. Right. But then again, there are some limitations to these new methods, and many of them have not been very validated. There is no outcome data, so that needs to be done. And I'm sure in the future it could play an important role in supplementing ejection fraction. I don't think it's going to dethrone ejection fraction anytime soon, but obviously it will be playing a supplemental role. Right. Thank you so much, sir, for your insight. And it's as simple as that. What is the importance of the left ventricular ejection fraction in the overall management of the heart failure? Thank you so much again.
Thank you, man. Thank you.